Lorna Vanderhaeghe, is going to talk to us about understanding thyroid health. And Lorna Vanderhaeghe is a women's health advocate for over 35 years. She's the author of, how many books, Lorna? 13 books, including A Smart Woman's Guide to Hormones. Early in her career, she had the honor of working for the Journal of Orthomolecular Medicine alongside nutrition pioneers, including the late Dr. Abram Hoffer and the late Linus Pauling. She was listed as one of Canada's top 100 female entrepreneurs in 2011, 2012, and 2013. With degrees in nutrition and biochemistry, Lorna developed a line of nutritional supplements specifically for women. Lorna continues her mission of empowering women to achieve optimal wellness through nutrition and lifestyle changes. Welcome, Lorna. We're really excited to hear what you have to share with us.
Thank you so much for having me. Very excited to be here. And today we're going to talk about understanding thyroid. So what does the thyroid gland do? It produces two hormones. We know them as T4 and T3. It also produces calcitonin, which is to regulate calcium and bone health, and it literally affects every cell in the body. And when I talk about thyroid, I always call it the master conductor because it has such an interaction with every cell in the body. And really, we have such an epidemic of low thyroid in Canada today that this is one of those health conditions that just affects so many women. And when the thyroid doesn't work, we develop either overactive or an underactive thyroid. And we call the underactive thyroid hypothyroidism. We often see this with Hashimoto's, which is a permanent low thyroid type condition. And thankfully, hyperthyroid affects less than 2% of the population. It's a very serious health condition. It's associated with Graves' disease. It's an autoimmune type of thyroid, and thankfully, we don't see a lot of it because it is very difficult to treat. And so today's talk, I'm going to focus mostly on what we see commonly, which is low thyroid or hypothyroidism. Hypothyroidism in Canada, we have about 23% of the population already taking thyroid medicine, and that is predominantly women. We have another category of people that I feel is an even larger group of people, up to 20 to 30% of the population that are undiagnosed thyroid patients. This group we classify as the subclinical hypothyroid group, the group that keeps getting normal blood tests at the doctor's office, but has all of the symptoms of low thyroid. And the spectrum of thyroid disease has a very broad range from mild to subclinical to severe. And this, I think, is one of the contributing factors to why we can't get adequate diagnosis often. And I think also there's just far too much reliance on thyroid testing. And you know this with your own clients, and you're in the same situation as I am when I help people, is that often we don't have thyroid tests in front of us. We can't order thyroid testing. And another problem is, even if your client has gone to the doctor and had their thyroid tested, often all the tests that they have is a TSH, or a standard thyroid stimulating hormone test. And literally, the thyroid hormone is a gas pedal for thousands of chemical reactions in the body. So when you have such a large group of people with potential thyroid or low thyroid problems, this is a concern. And interestingly enough, not every province in the country has the same normal reference range when you do have a TSH test completed. So I'll give you kind of the average, which is 0.4 to 5 is the normal reference range. And I hate to even use the word normal because I don't think that reference range is normal at all. And most people that I see will have to have a TSH well above 5 before they're ever given thyroid medication from the doctor. So an elevated TSH, now if someone is lucky enough to actually get their T4 thyroid hormone or their T3 thyroid hormone tested, an elevated TSH with a normal T4 and T3 is the definition of subclinical low thyroid. Often what I've found from my many, many years of experience, I've been researching, writing on nutritional medicine now for over 35 years. So I've seen a lot of clients. Often people feel best when their TSH is below 2. And one of the things that would be good is if people actually tracked this and had an annual TSH, so at least they could notice when their thyroid is starting to go into a problematic range. But ultimately, I think that we need to stop looking at the test number and actually start looking at the client, because thyroid disease is so systemic. It affects every system in the body. And I think that a lot of us have forgotten that your thyroid is involved in whether or not you're going to be happy, sad, or depressed. You know, if you've got that feeling of pushing yourself through the day, it could literally be your thyroid. Your thyroid is involved in your heart rate. So whether or not you have abnormal heartbeat, increased or decreased blood pressure, your thyroid is involved in cardiac output. And for women, there is a direct connection between the heart and thyroid that I'm going to talk about in a little bit because it's so important. Your thyroid is also involved in the kidneys. So you have decreased function, fluid retention, edema. The thyroid is involved in cholesterol manufacture. We see increased lousy or LDL cholesterol. We see elevated triglycerides in people with low thyroid. Your thyroid is involved in how quickly food moves through the digestive tract. So people get constipated, they get weight gain, and that gridlock constipation that just is not treated with standard traditional methods often is associated with low thyroid. Bloating is another one, and the reproductive system is directly connected to the thyroid. So we see decreased fertility, we see menstrual abnormalities, we also see problems with fetal development. So the thyroid is literally the master conductor, and it is constantly communicating with all the systems in the body. So we should spend a little bit more time focused on how we can get it corrected. And I've written a book called The Smart Woman's Guide to Hormones. And because what I found over my many years is that a lot of people cannot get adequate testing at their doctor's office. And a lot of people don't have the extra funds to pay for testing either. And so I dedicated an entire chapter in that book to symptoms, so that people could check off the symptoms of whether or not they had low thyroid or hyperthyroid, low estrogen, high estrogen, low progesterone, high progesterone, so that we could really get focused on looking at the client or looking at our bodies and understanding what might be going wrong. So here are some of the common symptoms of low thyroid. And one of them that I find that's really common is a third of your eyebrows have fallen out and you did not pluck them out. You're losing hair, particularly along the part line or the side of the head, irregular heartbeat, you're tired, you're constipated, you have dry skin, your hair feels dry and coarse. Hoarse voice is another one. Anemia, we also see irregular heartbeat, cold intolerance. So you're cold and you're wearing fleece when everyone else is warm. That was me. You get weight gain, but you have what we call stubborn weight loss. You just cannot lose those pounds no matter what you do. Heavy menstrual periods is another one. Brittle nails, infertility, and this is a big one. You know, today we have a very serious problem with infertility, and I think a lot of it has to do with the thyroid. And infertility, especially recurring miscarriages, are directly linked to low thyroid. And this is where you really, if you're going to a fertility clinic, I am sure that they are focused on making sure that that TSH is below 2. And some clinics it's 2.5, but really we want to have it below 2.5 in order to get pregnant and stay pregnant. The other thing we find is in women who are menopausal that when they have low thyroid, they often have raging hot flashes and night sweats, or what we call the never-ending menopause. So that's the aunt that's still coming to Christmas dinner who's sweating profusely many, many years after her periods have stopped. And one of the classic signs of low thyroid is in women who are still getting regular menstrual periods, but are getting night sweats. That can be due to low thyroid as well. So I always think it's important that we really look at the client and understand what are the symptoms of low thyroid so that we can keep track of them. I also think it's important that we look at not only just thyroid, but let's look at all of the steroid hormones. And all our steroid hormones are derived from cholesterol. So although cholesterol gets a bad rap, we need to have adequate amounts of cholesterol. And often in women, especially who have low thyroid, their cholesterol goes up. Well, why? Because the body needs to make more hormones. And I'm going to talk about that on the next slide. But so we have where our hormones derive from, and we have these adrenals that sit on top of our kidneys, and I call the adrenals the backup hormone system. So your adrenals are involved in the manufacture of cholesterol, your stress hormone, DHEA, the male hormones, androstenedione and testosterone, as well as estrogens, a little bit of progesterone. And these adrenal glands are directly linked with your thyroid. They have a cross-talk communication. I'm sure that there's been other adrenal talks over the weekend. But the adrenals are essential for proper balance. And for someone who's had their thyroid removed or radiated or have a thyroid that isn't working at all, the adrenals are going to pick up the slack. So the adrenals are very, very important. The thyroid, as I mentioned, is involved in the manufacture of T3 and T4, as well as calcitonin, and is essential to our female hormone balance. The liver is involved in cholesterol manufacture. It's also involved in the detoxification of hormones, the conversion of hormones to other hormones, which is so important. It's also involved in things such as, keeping your healthy estrogen from converting into the cancer-causing estrogen. The liver is essential. It's the sentinel organ for hormone function. So if we're under a lot of stress due to the consumption of too much alcohol or bad food, the liver is going to suffer. And as a result, our hormone balance will as well. The gut is everything from our mouth to our butt. It is involved in the conversion of hormones and the detoxification of hormones. And in my opinion, everyone should be taking probiotics and looking after their digestive health. And of course, it's directly connected to the thyroid as well. Our fat cells are also hormone factories involved in the conversion of testosterone to estrogen. And the ovaries have little receptors on them for T3 thyroid hormone. The ovaries are also involved in the balance of everything in the body. And in every single woman, our ovaries are going to take a much needed rest at menopause. And then the adrenals are going to kick in and make our hormones for us. One of the challenges that we have, of course, is estrogen dominance in North America today, which I'm going to talk about in a moment. So sex hormones and the thyroid, how are they all interconnected? So cholesterol increases in people with hypothyroid. DHEA is often low in those who have hypothyroid. Estrogen binds to thyroid hormone, decreasing thyroid hormone. And estrogen blocks the uptake of thyroid hormone. And this, I think, is a very important point, because if you are estrogen dominant, and we're going to talk about how do we know if we're estrogen dominant, this blocks the uptake of thyroid hormone. How did this ever get discovered? Well, they actually learned when they were giving women synthetic estrogen in the form of Premarin that a lot of the women on the drug studies were developing thyroid or low thyroid problems or hypothyroidism. And we've learned that higher amounts of estrogen block the uptake of thyroid hormone. The other thing is that progesterone increases thyroid hormone. So here you end up in a problem where estrogen and progesterone are supposed to be in balance. When estrogen is too high, progesterone can't modify its effects. And progesterone increases thyroid hormone. So if you're estrogen overloaded, you ultimately are at risk of creating thyroid problems, particularly low thyroid. And this may be the reason why we see such a higher increase of low thyroid in women versus men. In men, though, low thyroid can lower testosterone levels, so especially free testosterone. So if you're a man and you've gone to the doctor and you've had a free testosterone test and it's low, hopefully they've also looked at your thyroid, because the two are linked. There is a direct connection with the thyroid and PCOS. And what we have found is prolactin levels in women can also be elevated when TSH levels are high. So TSH levels would be high in someone who has low thyroid. So the thyroid ovary connection is a big one. We know that women who have elevated TSH can often have cystic ovaries. The issue with polycystic ovarian syndrome, how do we know about polycystic ovarian syndrome? And I know that I think you've had a talk on it this weekend as well, but hypothyroidism has to be ruled out before we have a diagnosis of PCOS, because what came first? The hypothyroid or the PCOS? And when I talk about fetal development, it may be that what is happening when babies are being developed in the womb, that they're not getting enough thyroid hormone, which may be the underlying cause of PCOS to begin with in the first place. And polycystic ovarian syndrome, we determine this by symptoms. So here are some of the symptoms, things like oily hair, acne. We can have facial hair growth, more body hair, irregular periods, no periods, weight gain, which is more common, although you can have a thin polycystic ovarian syndrome person. Not everyone who has PCOS gets cysts in the ovaries. So that just creates more confusion when we're trying to understand who has PCOS or not. But it is very common today. It is a pre-diabetic condition. So we see elevated blood sugar and insulin as well, alongside elevated male hormones. So there's a lot of things that would be put together in order to diagnose those. But if you have someone who comes to you who is young, who's overweight, who has more hair growth, who has acne, greasy skin, and irregular periods or no periods, I would definitely be looking at PCOS. And of course, the thyroid-ovary connection is important, especially because the ovaries have receptors on them for T3 thyroid hormone. None of our hormones act independently. They are all interconnected. And when you realize how interconnected they are, then you know that you've got to look at everything, not just one simple gland. So it's always hard to do a talk just on thyroid when I know that all the systems in the body are affected or connected when it comes to especially low thyroid. And I think that we need to spend more focus and time looking at pregnant moms before they get pregnant moms, and fetal development, especially when it comes to things like thyroid and iron. And I'm such an advocate of iron for women in general, but especially preconception and during pregnancy. When it comes to low thyroid, the impact of a mom's low thyroid on the fetus depends on how severe the mom's thyroid is. And considering that a lot of women can't even get diagnosed properly who have low thyroid, this can be a really severe, long-lasting, impacting position, especially when you look at the female offspring of a woman who has low thyroid. So I think this is the reason why the body is so smart. We see an increased number of miscarriages and infertility in women who have low thyroid. Why? Well, because the body really has to make sure that you've got adequate thyroid levels before you get pregnant. So infertility is often seen in women who have a TSH that is above, sorry, this is incorrect, above 2.5. We want to have a TSH below 2.5. Uncontrolled hypothyroidism, which I think is rampant because we have a huge group of people that have normal TSH test range, but they really do have hypothyroidism or subclinical hypothyroidism. We see recurrent miscarriages in women who have low thyroid. We also see the connection with anemia and miscarriages and low thyroid. We also see more later stage pregnancies with fetal demise or stillbirths. We see preterm delivery, low birth weight, preeclampsia, placenta abruption, and developmental problems, or including reduced IQ in infants that are born to moms who the mom has low thyroid that's not being treated properly. So why is all of this? So during early gestation, the fetus receives its T4 thyroid hormone from the mom. via the placenta. The fetus's need for thyroxine, which is T4 thyroid hormone, starts to increase as early as 5 weeks of pregnancy. So you don't even know you're pregnant at this point. And the fetus's thyroid does not develop until 10 to 12 weeks. So this fetus or this new baby is completely reliant on mom's thyroid hormone up to 12 weeks of fetal development. And then we also need to provide a little bit of our own thyroid hormone to the fetus until term. The fetus relies on maternal T4 exclusively. And maternal hypothyroidism could be detrimental to fetal development if not detected and corrected very, very early. So this is why it's so important before mom gets pregnant that she has an adequate thyroid evaluation, and really that TSH needs to be below 2.5, and in my view, below 2. So now let's look at the heart and thyroid, because for women especially, they've done some new research where they found there's a direct connection to subclinical low thyroid or poor thyroid management in women and increased rates of congestive heart failure. That's when your heart keeps getting bigger and bigger and bigger because it just is having to work so hard. 13% of people with high cholesterol are hypothyroid. And elevated TSH can cause high cholesterol, even if T4 and T3 are normal. So this is important. That's that high cholesterol thyroid connection. So anybody who walks into your clinic who has high cholesterol, we need to definitely look at their thyroid. And low thyroid, so when you have low thyroid, the body removes less LDL cholesterol from the liver. So we end up with elevated lousy or LDL, the bad cholesterol levels. And T3 is so important for supporting the liver and cholesterol function. So literally, if you have cholesterol issues or elevated triglycerides, you need to make sure that your thyroid is working well. And I call it the little gland and the big heart because the two are so associated, and our heartbeat is modulated by our thyroid hormone. So low thyroid can cause heart arrhythmias or premature beats. We call them PVCs, or atrial fibrillation, so irregular heartbeat. So if you're that person getting that regular heartbeat in your throat or your chest, we definitely need to go back and look at thyroid. And low thyroid hormone also causes blood vessels to stiffen, which causes high blood pressure or hypertension, especially in women. And low thyroid, again, increases cholesterol, and heart disease can be accelerated in women who have low thyroid. The increase in LDL cholesterol and CRP, so CRP is C-reactive protein. It's an inflammatory protein that's produced in the liver. Again, a test that people can have done at their doctor's office. And when those two are elevated, then we see an increase in heart disease. And this link between congestive heart failure in women that have poorly managed thyroid. And, you know, a lot of women will be put on thyroid medication. They are put on that dose and no one ever looks at it again for 20 years. So it's incredibly important that we start to really teach people about proper management of their thyroid health. Let's talk about estrogen dominance in the thyroid, because at the beginning of the talk, I mentioned that high levels of estrogen have a very negative effect on the thyroid and can block the uptake of thyroid hormones. So this is the connection between estrogen dominance. How would you know if you're estrogen dominant? Because we know that blood tests for estrogen are basically not effective. A lot of people cannot have saliva hormone testing. A, they don't have it in their neighborhood, or they can't afford it. And so how do we know if someone's estrogen dominance? Well, belly fat weight gain is a big one. Breast cysts, ovarian cysts, endometriosis, uterine fibroids. These are all signs of elevated estrogen in the body. So high estrogen actually has a negative effect on iodine intake in the thyroid. And we know the thyroid requires iodine in order to make these hormones. Estrogens, there are estrogen receptors in the thyroid, and studies show that a proliferation of thyroid cells happen as a result of estradiol, and we end up with goiters. So there's a lot of research that's been done around giving estrogen replacement therapy to women orally and watching what happens in their thyroid. Thyroid cancer is 3 times more common in women. We see thyroid cancer rates increase in puberty, so in teenagers, and then decrease at menopause. And this is the connection between thyroid cancers and estrogen. So the thought is that estrogen elevates or surges in the teen years and then declines at menopause. Not always declines at menopause, we now know, but more often than not, it does. Estrogen replacement therapy also increases thyroxine binding globulin, which thereby decreases T4 thyroid hormone in those on thyroid medication. So if someone is put on estrogen replacement therapy, whether it is oral bioidentical or oral synthetic, their thyroid medication dose may need to be adjusted as a result. And back to my comment about how do you know if you're estrogen dominant, especially if you can't get adequate testing, or in case you want to look at body physiology or symptoms, things like uterine fibroids, breast lumps, ovarian cysts, endometriosis, heavy periods, a thick uterine lining, adenomyocytes, which is a thick uterine lining with potential abnormal cells, as well as breast and ovarian cancer. So estrogen dominance is a huge problem in North American women. And I think it doesn't get enough exposure. Why do we see so much of it? Well, the body is making estrogen, but we're also exposed to estrogens in our environment. And some of the common estrogens are things like from pesticides, herbicides, and fungicides. They act just like estrogen in the body. They fit right into estrogen receptors. And this is the reason why I am a huge proponent of organic food. And whenever somebody talks about the difference between conventional and organic food in regards to its nutritional content, I'm always like, let's have a conversation about the estrogen mimickers that are found in pesticide-laden food, because that is far more dangerous than anything out there. Dark hair dyes are full of phenylene diamine, which is an estrogen mimicker as well. Remember, we just discussed that estrogen blocks the uptake of thyroid hormone. So we can't just look at thyroid. We have to look at what are people eating, what are they putting on their skin, what are they exposed to. Parabens in cosmetics. The skin is a wonderful delivery system for drugs and other agents. We have to remember that if we're putting creams and cosmetics and lotions on our skin, if they contain parabens or phthalates, we're potentially increasing our estrogen overload. Plastics in the form of BPA and phthalates, these also we know are estrogen mimickers or endocrine disruptors, hormone disruptors, xenoestrogens. Farmed fish, as well as the pill and HRT, are listed in these endocrine disrupting category, and commercially produced meat and dairy, which also contain some hormones. What are the worst hormone disrupting foods? Well, alcohol, which raises estrogen levels, commercial dairy products, which are higher in estrogen, commercial meat and chicken, which have estrogen and synthetic testosterones, farmed fish, pesticide-laden fruits and vegetables, and soy products. And one of the terms that you won't hear me talking about is the term phytoestrogen. So when I do a talk to consumers, I don't use that word because it is a very confusing word. Phytoestrogens are plant estrogens. That's the simple definition. But those phytoestrogens have multiple different mechanisms of action in the body. They can mimic estrogen. They can fit into estrogen receptors. They can block estrogens. They can reduce estrogen. They can detoxify estrogen. So one word that has 5 or 6 meanings is often used so commonly and yet not defined as to what is the actual action of that phytoestrogen in the body. And when it comes to soy, you know, there has just been a tremendous amount of research done around soy products. You know, are soy products estrogenic? How do they affect the body? Are they anti-thyroid? And I like this study. Dr. Michael Murray actually gave me this slide. This study was done in women. They had them drink 1 8-ounce glass of soy milk. Then they tested their estradiol, which is a very powerful estrogen, in saliva. So a very good way to look at estradiol after soy consumption. And what they discovered was that on average, the participants had their estradiol go up 280%. In some women, their estradiol went up over 1100%, which is absolutely astronomical because estradiol is a very powerful estrogen. And as we know, estrogens can block the uptake of thyroid hormone. So if you have a client who's consuming, Venti-tall soy, Venti lattes that are made with soy every single day, this could be a reason why they have problems going on with their thyroid. One of my favorite nutrients is indole-3-carbinol, and I call it the superstar nutrient. Indole-3-carbinol is found in cruciferous vegetables. When you consume indole-3-carbinol, especially in a supplement form and also from cruciferous vegetables, one of the breakdown products, and remember there are many breakdown products from indole-3-carbinol, but one of the most researched one is DIM. And a lot of the research that is discussing DIM actually provided indole-3-carbinol and then measured DIM as an output in order to make recommendations about DIM. So indole-3-carbinol is a superstar. DIM has also got some excellent clinical research. And so I wanted to talk about this because in order to have a thyroid conversation, we've got to talk about balancing estrogen levels in the body as well. And indole-3-carbinol actually has some of its own research in regards to thyroid hormone or thyroid health in general. So indole-3-carbinol eliminates excess estrogen or bad estrogens via the liver. Indole-3-carbinol increases the good estrogen, which is 2-hydroxyestrone. It inhibits the bad estrogen, which is 16-alpha-hydroxyestrone. And the research is so clear that Health Canada has provided the claim for indole-3-carbinol that it halts the conversion of 2-hydroxyestrone to 16-alpha-hydroxyestrone. For Health Canada to give such a claim to a nutritional supplement will only happen if the research is quite good. Indole-3-carbinol protects against estrogen dominant cancers, including breast, prostate, and cervical cancers, and endometrial cancer as well. There's been some work where they looked at indole-3-carbinol along with tamoxifen, which is a chemotherapy drug that is given to estrogen receptor positive breast cancer patients. So there was synergy there. What I have found in my many, many years of helping women is that indole-3-carbinol works to stop flooding periods. Ovarian cysts stop recurring, and endometriosis, fibroids, and acne also can be very effectively managed using indole-3-carbinol and DIM, along with some other nutrients like calcium D-glucarate. These cruciferous vegetables are truly superstars, and I'm going to tell you about something that will be contrary to what we're always told about cruciferous vegetables. There's some very old research in regards to human papillomavirus, which is involved in the development of cervical cancer, abnormal cervical cells. And the interesting thing is HPV, the virus, is so smart. It actually needs 16-alpha-hydroxyestrone in order for it to convert and develop into cancers. If the feeling is, if you do not have 16-alpha-hydroxyestrone present, then HPV could possibly be harmless, which is a huge concept of its own. And when we looked at this old research, they gave women 200 milligrams of indole-3-carbinol. These women had CIN2 and CIN3 abnormal cervical cells based on Pap smears. They gave them 200 milligrams of indole-3-carbinol daily, and 50% in the treatment group had normal cervical cells at the end of the study. None of the placebo group had any change. So this is a really profound situation that we could actually help to prevent the abnormality of cells on the cervix using something like indole-3-carbinol, which also has the wonderful benefit of halting the conversion of your healthy estrogen into 16-alpha hydroxyestrone, which in my mind is the bad estrogen. Indole-3-carbinol is also found to halt tumor formation in colorectal cells. But when it comes to the thyroid, indole-3-carbinol inhibits thyroid cancer cell lines, as well as follicular carcinoma of the thyroid, and inhibits human goiter cells. And I have used indole-3-carbinol throughout my many, many years of helping women to shrink goiters. Now you go, well, that's kind of strange, because haven't we been told that the consumption of goitrogenic goitrogenic vegetables like cruciferous vegetables actually makes thyroid worse? Well, they actually did a new study using DIM where they showed that it decreases goiters in cell lines by almost 70%. So that was quite exciting to me. They have to continue that research in humans, but it is exactly what I've seen over the years when people come with thyroid nodules or with large goiters, that using something like indole-3-carbinol and DIM could be beneficial. As well, indole-3-carbinol reduces tumor development of the endometrium and the cervix, and also for prostate cancer cells. So it really is one of my absolute favorite nutrients. And if you have people that are estrogen dominant and have those estrogen dominant conditions, it really is their friend. Let's look at herbal thyroid support as well as nutritional thyroid support. And one of the nutrients or herbs that I like for herbal thyroid support is ashwagandha. It has a multi-action. So it works as well on the adrenals, which I'm sure you've already heard about this weekend. I particularly like the sensoril ashwagandha. It is a standardized ashwagandha, meaning you get the same amount of withanolides, which is the active ingredient, in every dose. I also like it because they have a certified organic ashwagandha. And for myself, when I was developing nutritional supplements, we often had to reject the ashwagandha that we received in our building because it was out of spec. And sensoril ashwagandha is just such a beautiful ashwagandha. I think it's KSW is also a good one as well. So what does ashwagandha do? Well, it works directly on cortisol. And we know when cortisol levels are balanced, the thyroid is also happy. It improves sleep quality, which is so essential for a healthy thyroid. It improves mental and cognitive health, moods, fatigue. It also has been researched for cardiovascular health because it controls inflammation. And in Canada, ashwagandha has a Health Canada claim for lowering C-reactive protein. So it brings that inflammation back into check. As well, ashwagandha enhances T4 thyroid hormone. It improves the conversion of T4 to T3 when used with Google lipids. There is a specific type of Google lipid you have to use. It's called Commiphora mucal, and that's the one that's been researched along with ashwagandha to improve thyroid health. It lowers TSH as a result of this improvement in the T4 to T3 ratio and enhancing T4. It also improves desire and libido, and I think it was the KSW ashwagandha that did that clinical research. Ashwagandha is not for people with hyperthyroid. And over the years, I have always sent the hyperthyroid consumers back to their medical doctor because it's just such a challenging condition to treat, and it's actually quite dangerous. What nutrient support should we be using for low thyroid? Well, one of the things we want to do is make sure that people are consuming enough protein, and women tend to be very low consumers of protein, and we need to have adequate levels of protein in order to get enough tyrosine, which is an amino acid found in protein, which is essential for thyroid health. So iodine and tyrosine bind together to make thyroid hormones. So tyrosine lowers an elevated TSH. So when people have hypothyroidism, they have a high TSH. Tyrosine lowers that. And it's just such a wonderful thyroid support nutrient. Again, it's not recommended for people with hyperthyroid. Excuse me. Selenium is also a key nutrient for thyroid. And I live in Vancouver, and Dr. Harold Foster, who used to be at the University of Victoria, did a whole study on selenium, low selenium levels and increased rates of breast cancer. And we know that women who have low thyroid also have higher rates of breast cancer. It may simply be, again, back to this selenium scenario. And selenium, my favorite form of selenium, there are basically two found in nutritional supplements. One is selenium selenite and the other is selenium-methionine. And selenium-methionine is the form found in human tissues. It's also the safest form of selenium. It has low toxicity. And selenium reduces anti-thyroid antibodies. So for anyone who has autoimmune disease, it is the key nutrient, the type of selenium that we should be using. Low selenium also increases the risk of thyroid nodules or goiters, large thyroid. And low selenium is associated with Hashimoto's. So Hashimoto's is the form of low thyroid that they call permanent low thyroid. Selenium is very thyroid protective. You will notice that most thyroid supplement formulas will have selenium in it. And my favorite form is selenium-methionine. Selenium is actually found in a high concentration in Brazil nuts that have not been cracked. So if you buy Brazil nuts in their shell and you haven't cracked them yet, they will have selenium in them. As soon as you crack them, they start to lose their selenium content. Fish also contains selenium as well as eggs. And of course, that would be free range, wild or organic eggs. And low vitamin D3 is also found in autoimmune thyroid and thyroid cancers. And we have higher rates of low thyroid in the north. So this could very well be due to the whole vitamin D3. The one good thing that's going to come out of COVID is that I think people are finally taking adequate doses of vitamin D3. And we know vitamin D3 also modulates the immune system. Potassium iodide is a very well-known, very well-researched, very old researched mineral for the thyroid. And potassium iodide is the form of iodine. So it's iodide. It actually has 3 prongs on this form. It's found in nature in seaweed and natural salts, and it is the most soluble form of iodine. It was added to our table salt because here in Canada, we had such high rates of goiter because we don't consume or didn't consume a lot of iodine containing foods. Much of the iodine we eat is used by the thyroid gland, and the rest is taken up by the breast, the bone, and the stomach. And the main function of iodine is to make thyroid hormones, but it also causes cancer cells to go through apoptosis or basically blow up. So we need to have adequate iodine, and there's a connection between thyroid, iodine, breast cysts, fibrocystic breasts, ovarian abnormal endometrial cells, and cervical cells as well. And in the old days, they used to paint the cervix with topical iodine when someone came in with abnormal cervical cells. So everything is so connected. H. pylori is also killed in the gut by potassium iodide. So low iodine levels is not a good thing. They found super high fat diets also can block iodine uptake. So if you're on a full keto with lots of fat and protein, you probably want to make sure that you're getting enough iodine in the diet as well. And there is a connection between iodine, thyroid, and breast cancer and abnormal pap smears. So we know that we need to have adequate amounts of potassium iodide or iodine in our diet as well to have a healthy thyroid. So this is what a goiter looks like. This is actually a small goiter. When they're very small, you may think that your client just has a layer of fat on their neck. So again, this is the look at the client's neck to see what does it look like. Why do goiters develop? Well, literally when a goiter is developing, it's because the thyroid gland is not making enough hormones. So the thyroid tries to get bigger so that it can gather more iodine and nutrients. And you could think about an octopus spreading out. That's literally what is going on with a goiter. Certain areas of the world have endemic goiters. That means they're found there because there's not enough iodine in the diet. Or other areas in the world, like there's parts of South America where lithium is found in very high levels in the water and the soil, and they also have goiters as a result. We see more goiters in women. Well, that makes sense. There's more low thyroid in women. It can be hereditary, and we see it more commonly in women over the age of 40, but subsequently we also see more low thyroid in women over the age of 40, which, by the way, women in their late 30s and 40s have huge surges in estrogen as well. Autoimmune disease also attacks the thyroid tissue, which causes goiters to grow. And those little nodular growths, which can become big growths, also are associated with all of these deficiencies that I've been talking about. And we need to protect this thyroid. We need to protect it from X-rays. We need to protect it from damage. And, you know, if you have a mammogram or dental X-rays or any kind of CT scan of your neck or your jaw, you need to protect your thyroid. It is absolutely essential to look after it. And of course, other things like fluoride also have a negative effect on the thyroid. And when my kids were little and going to the dentist, it was a no X-ray, no fluoride story, because I really wanted to protect their thyroid as much as we could. Thyroid, iron, and ferritin. So there is a direct connection to your iron levels and your ferritin, which is your iron storage, and the thyroid. So low iron decreases T4 and T3 thyroid hormone. Why? You actually need iron, and low iron impairs the conversion of T4 to T3. T3 is the more potent, more active thyroid hormone. So if your iron is low, and let's be clear, most women have low iron, especially if they're menstruating women. Low thyroid goes hand in hand with low ferritin, and because low thyroid promotes low hydrochloric acid in the stomach, you need your hydrochloric acid to break your food down. If you have low hydrochloric acid, then you cannot absorb iron. Low thyroid also lowers body temperature, which then causes you to make less red blood cells. What's carried on your red blood cells? Your iron, your hemoglobin, and your oxygen. So they're all related. If you have low iron and low thyroid, you literally feel like you're pushing yourself through the day. You have a hard time exercising. You can't even walk up a flight of stairs without huffing and puffing. And low thyroid causes heavy periods, which subsequently causes low ferritin, which then causes more heavy periods, and you end up in this vicious cycle. What are the symptoms of low iron? Things like dark circles under the eyes, peeling fingernails, heart palpitations, exhaustion, fatigue, recurring miscarriages, fertility problems, restless legs, low thyroid. The average Canadian, according to a very large study that was done, gets 8 milligrams of iron from our diet every day, when we really need 20. 20 milligrams from the diet is the recommended amount. And considering we're only getting 8, just think about the number of people that have low iron and the connection to their low thyroid. Only a couple more slides and I'll take your questions. How does the thyroid and osteoporosis interact? Well, we have 23% of the population already taking thyroid medication. One of the things we found is that too much thyroid medication and bone loss occurs because of an overstimulation of osteoclasts. Osteoclasts are the cells that break bone down. Remember, bone is not a static substance like a fence post. It's constantly being built up and broken down, built up and broken down. Too much thyroid medication and those breakdown cells go at it, and we end up with more osteoporosis. If there's not enough thyroid hormone, bone loss occurs as well. Solutions for those who are taking thyroid medication already is to supplement, add the herbs and nutrients that are known to support thyroid health. And calcitonin, which is the hormone secreted by the thyroid gland, keeps those osteoclasts from breaking down. You need to have enough vitamin D, calcium, vitamin K2, and magnesium and a healthy thyroid in order to prevent and treat osteoporosis. This is my last slide. And basically what I did on this slide was just to show you that the menopause symptoms that we classically define in Canada today, things like memory loss, insomnia, fatigue, no sex drive, weight gain, hot flashes, anxiety, bowel problems, cold hands and feet, are often related to a liver that's not working well, adrenals that are exhausted, and a low thyroid. And so if we got this, I call it the hormone triangle, if we get our liver, adrenal, and thyroid working, I bet that the majority of those menopause symptoms would simply disappear. So if you want to contact me, you can go to the website at lornahealth.com. You can email me at lorna@lornahealth.com as well. And of course, I have an Instagram and Facebook at Lorna Vanderhaeghe. And so I'm here to answer your questions.